Did you know that 1 in every 3 adults in the United States suffers from hypertension? It's a silent condition that often goes unnoticed until it's too late. Hypertension, often known as high blood pressure, is a common condition affecting millions worldwide. According to the American College of Cardiology and the American Heart Association for adults, hypertension is defined as a blood pressure of 130 over 80 millimeters of mercury or higher. A different set of criteria from the 8th Joint National Committee places that threshold slightly higher, at 140 over 90 millimeters of mercury. Broadly speaking, there are 2 types of hypertension, primary and secondary. Primary hypertension, accounting for around 90% of all cases, has no identifiable cause. It's a bit of a mystery, and it's this very mystery that makes it a formidable opponent. On the other hand, secondary hypertension is a bit more forthcoming. It's caused by a specific underlying condition. Typical culprits include renal diseases, endocrine disorders, and vascular diseases such as renal failure, primary hyperaldosteronism, and coarctation of the aorta. Now here's the tricky part. Hypertension is usually asymptomatic until organ damage occurs. It's like a silent intruder, wreaking havoc without making a sound. Commonly affected organs include the brain, heart, kidneys, and eyes. If early symptoms do appear, they may include headaches, dizziness, tinnitus, and chest discomfort. Suspecting hypertension isn't rocket science. If in-office blood pressure is persistently elevated on 2 or more separate measurements, hypertension is a likely culprit. Confirmation comes with out-of-office measurements. Further diagnostics may include an assessment of cardiovascular risk, evaluation of possible target organ damage, and additional tests if an underlying disease is suspected. Treatment of primary hypertension often includes lifestyle changes such as diet modification, weight loss, and exercise, along with pharmacotherapy. Commonly prescribed antihypertensive medications include angiotensin-converting enzyme inhibitors, angiotensin receptor blockers, thiazide diuretics, and calcium channel blockers. However, the pharmacological management for children and pregnant patients differs, as some of these drugs are contraindicated in these populations. When it comes to secondary hypertension, addressing the underlying cause is key. In summary, hypertension is a silent, common condition with 2 main types, primary and secondary. It's typically asymptomatic until organ damage occurs and is diagnosed through blood pressure measurements and further tests if necessary. Treatment involves lifestyle changes and pharmacotherapy, with the approach differing for primary and secondary hypertension. Remember, knowledge is power, and understanding hypertension could be the first step in managing it effectively.